dietitian who's been working with kidney patients for over 20 years. And if you have kidney disease, you're probably going to the labs to get your blood drawn on a regular basis. And how comfortable do you feel understanding all of those different lab tests and what they mean? I frequently hear from my patients that those lab tests might as well be written in a foreign language because they have no idea what those labs mean. Today I'm going to review the many different lab tests that I look at from a nutrition standpoint and provide you with a definition and understanding of how it relates to your kidney health. My goal is for you to be the CEO of your kidney health and understand your kidney disease and your lab tests. Know that making positive improvements in your diet, such as decreasing your blood sugars or improving your blood pressure or getting adequate amount of protein, can slow down the progression of your kidney disease. And how often should you be getting your labs drawn? Well, it depends on what stage kidney disease that you have. In the early stages of kidney disease, it's not generally required for you to get them done, but maybe once or twice a year. But as your kidney disease progresses, you might be asked to get them more frequently, maybe every couple months or maybe even once a month as your disease continues to progress and advance. Or maybe you have a medication change or a change in a medical condition that your kidney doctor asks to get your labs drawn just to see how it has impacted your kidney health. It is really up to the kidney doctor to determine how often you get those labs drawn. So let's get started and learn more about the labs. So the first couple labs help me to determine how well your kidneys are filtering their blood, how well they're performing their tasks for our body. And the first lab test that I look at is called an eGFR. It stands for Estimated Glomerular Filtration Rate. The eGFR tells us how well your kidneys are working. I kind of think of the eGFR as our performance score of the kidneys and how well they're working and doing their job. Or we can think of it as a percent of kidney function. So if your eGFR is, let's say, 42, then we can think of it as you have about 42% of kidney function. We also use the eGFR to determine what stage kidney disease that you have. The second lab test when we look at the functionality of the kidney is creatinine. Creatinine is a waste product that's naturally found in our blood, and it comes from the metabolism or the breakdown of protein in our diet, as well as the normal breakdown of our muscle tissue. And the third lab test is urea nitrogen. Urea nitrogen is also naturally occurring in our bloodstream, and it is a waste product that is from the metabolism, again, or breakdown of protein in our diet. Looking at the nutrition-related labs is albumin. The reference range or goal range for albumin is greater than 4.0. Albumin indicates how well you're eating, ensuring that you're getting enough protein. If the albumin level is low, it could indicate malnutrition or that you are spilling protein in your urine. Potassium, the goal range is 3.5 to 5.0. Potassium is an essential electrolyte or mineral that helps your nerves and muscles to work properly. But if potassium level gets too high, it can cause some heart issues. Phosphorus, The goal range is 3.0 to 4.5. Phosphorus is an important mineral that helps with bone health. It helps with energy production at the cellular level, and it helps with nerve function. But if phosphorus goes untreated for an extended period of time, it can cause weakened bones, joint pain, and hardening of the blood vessels, which can lead to heart disease. Hemoglobin A1C, the goal range is 6.5 to 8.0. Hemoglobin A1C is specifically for our diabetic patients. It measures the average blood sugar levels, how they've been trending over the last 2 to 3 months. If you're diabetic, you want to ask your healthcare provider what is your recommended hemoglobin A1C. We know that uncontrolled blood sugars is the number one cause of kidney disease. Another test that we look at for our kidney health is blood pressure. And the goal for blood pressure is 120/80. Blood pressure is the amount of force that your blood uses to get through your arteries. And if blood pressure is too high, it can make your heart work harder and it can damage the infrastructure of our kidneys. And if our blood pressure is too low, it can make it difficult for the blood to deliver oxygen and nutrients throughout the body. Are you taking your blood pressure at home? I strongly recommend it. And also making sure that your home blood pressure cuff is accurate. So maybe the next time you're going to an in-person doctor's appointment, bring that blood pressure cuff along with you and ask the healthcare team to check your blood pressure cuff to make sure that it's accurate. We know that high blood pressure is the second leading cause of kidney disease. I hope you now have a little bit better understanding of some of the different lab tests that we look at for kidney health and to provide nutrition recommendations. If you want to learn more about your kidney disease, I encourage you to check out my website, kidneyintel.com, to learn more about nutrition as it relates to your kidney health, as well as checking out my online kidney class called Kidney Essentials. I hope you found this video helpful. Like me and share this video with someone who you feel can benefit from it too. Until next time.